Damage to the eye caused by dry macular degeneration or long-standing wet macular degeneration cannot at the moment be treated. Some people with wet macular degeneration will be offered a form of laser treatment, but the more usual treatment now is with a drug injected into the eye to stop the formation of new blood vessels. The treatment is not a miracle cure, but it does help to maintain vision in most people who have it. The injections are given in hospital every 4 to 6 weeks. Naturally, at first, some patients are worried about having an injection in the eye.
They're usually quite disturbed by the fact it's an eye injection to begin with, but once they realise that they're going to have local anaesthetic drops and they're going to be well prepared, we take them through the whole procedure, and then they go into an injection room, which is non-threatening really because it's a small room, it's not an operating theatre. And we introduce that to them beforehand if necessary, because some people are very nervous about having a needle put directly into the eye. Lots of people think it's actually going to go into the eyeball directly through, the pupil area, and that's not the case. It's to the side. They also envisage that they're going to see the needle, going into the eye, and that's not the case either. Most patients, when they've had the procedure, don't realise actually that it's finished because it's such a quick injection. All of the time is spent with preparation, really. So we've never had anybody here not come back because the injection was too painful to tolerate. It's more the thought of the injection process.
Since about October 2007, I've had injections each month, either one eye or the other, or both. And I've had both done today. And there is no doubt that the treatment I'm having has managed to retain the sight that I had in my left eye, and is probably helping now towards retaining some vision in my right eye. Originally, you're marginally concerned about people injecting into your eye. After the first time, when they numb your eyeball by drops, it deadens your eye, so you can't feel very much. There is no sensation of pain whatsoever. You're aware that your eye is open and can't be closed, and that it's numb. But as for pain, there is none at all.
Whether or not your macular degeneration is treatable, you should still have regular eye examinations to check the health of your eye, not just your sight. Dry macular degeneration can become wet, and of course you may develop other eye or health conditions that could be treatable. You can help yourself by checking your own vision regularly with an Amsler grid, which can help detect changes in your vision. Hold the grid at normal reading distance, cover one eye, and stare at the spot in the center of the grid. If you have macular disease, parts of the grid may be wavy, distorted, or missing. Check both eyes, and if you think your vision has changed, have an eye examination straight away. Regular testing is just one way that you can protect your sight. Here are some more. If you smoke, stop. Take regular exercise to help control your blood pressure and protect your cardiovascular system. Wear good quality sunglasses to filter out UV light and save your eyes from glare, and wear a brimmed hat outside, even on cloudy days. You should also eat well. It's increasingly believed that diet plays a significant part in eye health.
The eye requires nutrients from diet to protect it from the ravages of day-to-day living. We now know that in AMD patients that they have low levels of key micronutrients that we get in our day-to-day diet from fruit and vegetables. One of the key nutrients is called lutein, and lutein is a plant dye that is found in particularly large amounts in green leafy vegetables like spinach and like kale, but it's also present in foods like fruit and sweet corn. What is not a question at all is that the only source of lutein we have Our bodies can't manufacture it. So the only source that we have naturally is from our diet. So if we take in lots of fruit and vegetables, then we get a reasonable level of lutein. If we don't eat fruit and vegetables, we are deficient in lutein. And that is dangerous for the development and the progress of AMD. What we really don't understand is if we super increase the amount of lutein, whether that makes any extra benefit. And that's a question that's out to study at the moment in very large trials going on in Europe and America.
One big trial in America did find that large doses of some vitamins and zinc can help people with advanced macular degeneration. And for that reason, some, though not all doctors, do recommend supplements.
Well, supplements have their place. I never think that they should be a substitute for a good diet. That's one thing from the outset. But they do give an opportunity to give a real boost to some of these vitally important antioxidants that we do need in our diet.
The Macular Society has useful leaflets about nutrition and other ways you can help protect your vision. While self-help is important in coping with macular disease, there's a lot of other help available too. Low vision experts help people to make the most of their sight. Your local social services department, eye clinic or blind society will know where your nearest centre is. This one is in Birmingham.
Patients can often be told there's nothing more that can be done, and that may be true as far as the hospital medical service is concerned, as far as the eye is concerned. But that is really the beginning point, and there's plenty that can be done as far as low vision is concerned. So this is really the beginning point of low vision services and where we can step in and try and help. We're here to look at anyone with visual impairment and try and make the most out of the vision that's remaining. So from the low vision clinic, where I work, we're looking at magnifiers and aids to make the most of people's remaining sight. Elsewhere on site here we have a resource shop where people can look at aids to help them with in daily living.
So it's got a camera and it's taking a picture of it, and I can drive it up or down depending on the size that I need to read with. Two different sizes. I lose that one though.
Yeah.
That's almost too big for me.
Yeah.
And that's better.
Oh, I can see that one.
Yeah, can you see that one?
There is a wide range of low vision aids and high-tech equipment, from simple handheld magnifiers to sophisticated computers and camera readers. A low vision expert can advise on what is most useful to you. Good advice about simple things, such as the lighting in your home, can improve a person's quality of life enormously.
And particularly with macular disease problems, lighting can make a huge difference in terms of not only reading, because people often look at lighting in terms of helping them read more, but also with other things within the kitchen, for example, at home, maybe it's sort of making a cup of tea, buttering a slice of bread. Good directional lighting can make a huge difference in how easy these tasks are.
It's knowing where to go and where the facilities are available. So in terms of lighting, knowing what sort of light would help, looking at different aids. What suits one person doesn't suit another person. Each person has a different need, but you have to, with the help of professionals, explore what's best for you.
If no one suggests you should have low vision advice, you can ask to be referred to a low vision service yourself if you're having problems reading or doing everyday tasks. If your sight loss is significant, you can be registered as sight impaired or severely sight impaired. This can entitle you to certain benefits, and in some areas is the mechanism for accessing help from social services. Your hospital consultant has to complete the registration form.